Healthcare needs of older people. It has always been our mission to support people to age at home with health issues. I address today what we see older people need to age healthy and well at home. The advantages of healthcare being shifted to the community are twofold. Firstly, it would help reduce admissions to acute hospitals where it is safe and appropriate to do so. And secondly, by enabling a home-first approach, people get treated and recover in their own environment. A core focus of Alone's model is linking community and acute services to enable all groups to work together to meet demands. It is strategically designed to bridge the gap between the various agencies and services, establishing Alone as a critical link in the continuum of care. Our evidence comes from the reports we produce every quarter that examines what older people need and what their emerging needs are. It is a detailed report that provides which provides a view into what ageing at home in Ireland is like. We have submitted the latest edition from the first quarter of this year and links to the previous report. Primary healthcare services. Older people experience considerable issues in accessing primary care, including public health nurses, occupational therapists, GPs and psychotherapists. Of the 1 in 3 people reporting to Alone for GP primary care issues in 2023, the majority required support engaging with the public healthcare nurse. The second most prevalent issue was support from occupational therapists. While we support older people to engage with PHNs and are available and access to occupational therapy, both pose a significant challenge. There are pinch points in the system of community care and for different reasons are very important. We ask for a review of the staffing levels of these strategic roles and to prioritise recruitment of them where and when needs. Loneliness and mental health. General health issues are the top reasons people look for support from us, and of these, loneliness is the main category. Last year, 2/3 of older people who accessed our services experienced loneliness or social isolation, some or all of the time. The EU Commission research says Ireland is the loneliest place in Europe. Ireland has over 7,000 engaged volunteers who give their time to support and befriend isolated people in the community. Yet commitments to develop an action plan to combat loneliness have not been realised. Alone is a co-founder of the Loneliness Task Force and a cross-generational coalition working to end loneliness in Ireland. Earlier this year, we launched the Loneliness Task Force Research Network to provide primary evidence on the issues as they present in Ireland. We call for funding and resources within the Department of Health to deliver the plan to combat loneliness as outlined by the Loneliness Task Force. In May, we welcomed the Senate motion calling on the government to live up to this commitment. Mental health difficulties remain a significant issue among older people. In total, 2,405 older people assessed by Alone in 2023 indicated they had issues with their mental health. Those prevalent mental health issues were dementia, Alzheimer's, followed by depression and anxiety. Research published this week by Aware and supported by Alone was found that 34% of older people experience mild or moderate depression, 41% experience mild or moderate anxiety, and 14% considered ending their lives in the last 12 months. Last year, we addressed the Oireachtas subcommittee on mental health relating to significant mental health difficulties being experienced by older people, and we would request an update from the committee on this report. I'm conscious of time, deputies. Am I okay to keep going? Yeah. Okay. In addition, we have engaged with Mimic in relation to the implementation of sharing their vision actions relating to older people. We've been told the decision to establish a specialist group relating to older people's mental health remains under review pending an update on progress later in this year. We call on a specialist group to be established under sharing the vision as a priority. Given the level of mental health issues, some of them unique to older people, we hope to see a similar focus be seen in as is seen in child mental health. It should not be either or, it should be a recognition of equal importance. House and health. The link between health and housing cannot be overstated. We note that the Institute for Healthcare Improvement described the different inputs to make a good healthcare system as are for every person: 40% socio-economic, 10% physical environment, 30% health behaviours and 20% healthcare. It is a holistic view, and I have included the links to health and housing. Given that the committee's brief, we want to highlight two specific areas. Housing adaptation grants. At least 50% of all housing adaptation grants that alone work with older people to secure are bathrooms. This will increase the access and ease of use of basic hygiene needs. In recent increases in funding only bring the grants levels available to 2010 levels. Engagement with the Department of Housing recently revealed increasing funding for all grants that has been negotiated with DEPA are challenging as part of the value for money and cost savings provided by the grant are to the Department of Health in terms of fall prevention and delay in accessing hospital and nursing home care rather than to the Department of Housing. Any health or social care worker where we speak to the need for funding of these grants, and yet they there does not appear to be significant cooperation between the two departments to advocate in this area. Put simply, these grants prevent falls. In our report, falls were identified as the primary physical health concern among older individuals, reflecting the critical intersection between housing adaptations and mobility challenges. Making homes safer is critical to preventing falls and maintaining older people's well-being. Housing with support. The lack of interdepartmental working is holding back the progress in relation to the development of housing with support. Committee members may be aware that the first Housing with Support demonstrator project will be up and running in Inchicore by the end of 2024. Because of considerable collaboration between Alone, Circle, VHA, the Department of Housing, Health, the HSE, Dublin City Council and is part of government strategy. It is an example of how housing options between housing and nursing home can be provided to offer older people independence and dignity. However, it is not replicable in its current state as the funding mechanisms are not replicable. Several elements of the funding are once-off arrangements between the two departments. Suitable funding structures to enable further developments have not been established yet. Given the estimated increase in demand in nursing home care in the current years, the findings of the Housing Agency in relation to the financial benefits of investing in supported housing for older people and the stated aim to provide care in the community, we call for cross-departmental structures to deliver this as we're committed to in 2019. Thank you.